Hi, my name is Dr. Steve Miners of Rehab Effects in Austin, Texas. Today we'll be discussing applied kinesiology. Applied kinesiology is a form of diagnosis that uses muscle testing. It has been in existence for several decades. The main chiropractor who invented it is Dr. George Goodhart back in the 1960s. What we found is that it's a primary feedback mechanism when we muscle test, and it allows us to determine the patient's inability or ability to function. The diagnosis that we're looking for is going to be one of either structural compromise, chemical burden such as heavy metals, visceral, myofascial, or emotional. It may be a combination of any of the above. Once we have formed that diagnosis, we then go about correcting it. That may include a chiropractic manipulation if there's structural involvement, cellular biocleanse therapy, which will be discussed in another segment for heavy metal exposure, for chemical, if we find a chemical diagnosis. Emotional, there may be some past negative or bad experience that the patient is still holding on to that needs to be addressed. Visceral, such as the stomach, the gastrointestinal system, liver, kidneys, that may need to either be detoxified with cellular biocleanse therapy, nutritional support with nutraceutical or pharmaceutical grade supplementation, or a myofascial condition that requires repair with cold laser therapy, which will be discussed in another segment, or manual manipulation. As a result of that, what we find is that the patient will experience a faster recovery with usually less pain during that time.